My first real encounter with prostate cancer was in the early 80s when a colleague of mine who I worked with very, very closely was diagnosed with prostate cancer. He was at that time about 50 years of age, and he in fact died 5 years later of prostate cancer. I have seldom seen such bravery in an individual. I was with him the day that he was told he was going to die, and he insisted on continuing on a project we were working on together. Enormous bravery, great guy, but he suffered immensely in the last weeks of his life. It was just heartbreaking to see how an active, intelligent, very capable individual went downhill to be a skeletal wreck and then died. My brother, as I said, was diagnosed 12 years ago with prostate cancer, and their father died with it age 95, and therefore there was an 80% chance of me having prostate cancer at some time in my life. So religiously every 6 months I had a PSA test, and then getting that result, if it was up again, my anxiety level increased further. And eventually, I got to the point of he sent me to the urologist. I thought they now have intervened, and they're intervening because there's a probability. I went in and had the biopsy done under general anaesthetic, and he said the results will be available in a week. So went in there with a fairly high degree of expectation that he was going to tell me I had prostate cancer. PSA had been rising, and the circumstances, I knew enough about it from my brother's experience and other friends and so forth, that I probably was going to be diagnosed with it. But when the words came out of my specialist's mouth, and I'd hardly sat on a chair, and he said, "Alan, you have prostate cancer." The whole circumstance then strikes home, as well as you've prepared yourself. Flashbacks to the 80s when my friend and colleague Doug was diagnosed, and all the bad things that happened to him near the end of his life flashed into my mind, and I thought, God, am I having to go through that path? Surely there's a way to get on top of it. But human nature takes you to look at the worst in that situation rather than the advances in medical science and other things that have happened in the intervening 30 years. When I was diagnosed, I had a chance to talk to a lot of other friends that also have had been diagnosed and treated for prostate cancer. There's quite a good friend of mine that had a radical prostatectomy, and he got a very bad outcome. He was impotent and incontinent. And whilst impotence is severe or challenging to a man, incontinence is probably even worse because you face it every day. And it also brought home to me the consequences of being infected with prostate cancer. You have to wear pads or the like, and it's really debilitating. So that had a lasting impact on me. You have a feeling that you want to get these cancerous cells in your body out of your body immediately. You want to be free of these things that are slowly but surely killing you. You want them out. You want to get rid of them. And that's all that really counts. And there is a way to prevent these things. And Spacethal is one of the ways that can substantially overcome the rectal burning issue. At the National Cancer Centre, after your last treatment, there's a gong, like you see in the old rank films. And the tradition has it that you bang the gong. And I did that. Prior to me ringing the gong, I had half an hour, 3/4 hour with the top man there. And after that discussion, particularly with his confidence and banging that gong, I felt, this is fantastic. I made the right decision. The cancer cells were gone, and I was free of the disease.